An outbreak of Lassa fever has been confirmed in Ondo State, and scores of patients have been affected by the disease. Those affected have been treated at the Federal Medical Center in Owo and other state government hospitals. Commissioner for Health, Wahab Adegbenro, says the issue has been addressed by government officials. A medical doctor, Toni Adeyemi, is with me in the studio to discuss this developing story. Thank you for joining us on the news. Now, for the past 5 years, the state, now talking about Ondo State, has witnessed the recurring issues or outbreaks of Lassa fever. And the question on the lips of some Nigerians is, are we really rising up to the occasion to deal with this issue head on?
Well, Lassa fever actually has a seasonal pattern. So usually it's more common in the dry season between November and May. That's why it appears as if in some months you actually have a higher incidence of Lassa fever. So ongoing actions are in place right now in Ondo State and other nearby states, because not only in Ondo State that we have cases of Lassa fever, which they're trying to identify the primary case, isolate them, treat them, and also do a contact tracing so that all those that have come in contact with this affected person can be traced for the incubation period of Lassa fever. Then also, because it's caused by a rat, multi-mammate rat called the Mastomys natalensis, environmental sanitation is very important. The environmental hygiene, one of the things that drives this rat to where humans actually live, because it's not the common rats we know and it's not the type we see around us. By the time humans start getting involved in activities like bush burning, they tend to displace this rat.
Yes, a lot of that. Yes. So they run
away from their natural habitat, their abode, and come into the dwelling place of man. And so by the time they interact with man, they can either infect man from the rodents to the human, or there could be human-to-human transmission of Lassa
So how, on the part of prevention now, because a lot of advocacy had gone on times before now, I'd like for you to educate Nigerians on what they can steps to take in terms of prevention, because they say prevention is better than cure.
Oh yeah, most certainly. So the most important thing for Lassa fever, because it's caused by the rats, is environmental sanitation, environmental hygiene. Then of course, do not leave your food because it's transmitted by the droppings of this rat. So it could either be urine, feces, or even the blood of the rat. So if you leave your food exposed, if you live in an area, first of all, get rid of rats in your surroundings and in your house, if you have rats at all, because you can't really know which one is the multi-mammate rat and which one is the regular rat.
Right.
Then, of course, your surroundings, keep it clean, keep it away from rats, cover all food substances.
All right, let's quickly talk about human-to-human contact transmission now, how it can be prevented. What are the signs, symptoms that people can look out for to know, so that it's not as if there's discrimination, but just trying to prevent it as well?
Okay, the human-to-human transmission is actually more common among health workers or caregivers of the affected individual, because they're the ones that take care of the sick person that has been infected with Lassa fever, and they're the ones that come in contact with their body fluids. So it's actually universal standard precautions for health workers or caregivers, because they're the ones that come in contact with this patient. But the signs and symptoms, they are very general, so they are not specific. They mimic any other febrile illness like malaria, so you could have headache. But the most important thing, if you have a fever that is not resolved after 48 hours after using the right medication, then please report to your nearest hospital, nearest health center to be tested.
Thank you so much, Dr. Toni Adeyemi, for your time on the news.
Thank you for having me.